There are 26 bones in the adult human foot. Although these bones are small and they don't do much, as a unit they do a lot to get you moving forward. Who cares about all those little bones in the foot? No one, except people who hurt them. 10 weeks ago, I broke and dislocated 2 bones in my right foot. This has been quite a learning experience. One thing I learned about was anatomy. There are 5 bones in the human foot called metatarsals. The 7 short bones between the metatarsals and the leg are referred to as the tarsals. The 3 joints between the metatarsals and the tarsals are called the tarsometatarsal joints. They're also commonly called the Lisfranc joint complex. Jacques Lisfranc was a gynecologist and field surgeon who served in Napoleon's army. He described amputations at the midfoot level. Mechanisms of injury is a term used to describe the ways in which an injury is sustained. In Napoleon's time, it was common to have a Lisfranc injury occur when a person fell from their horse with their foot caught in the stirrup. Today, this mechanism of injury is rare. Most Lisfranc injuries today are caused in motor vehicle accidents, crush injuries, or are a result of sports-related injuries. In my case, the mechanism of injury was dirt biking with my Suzuki DR650, pictured here. I was riding my motorcycle off-road on a trail that had a lot of rocks and grooves in it from the rain. I accelerated, misjudged a turn, and tipped the bike onto my foot. In principle, treatment of midfoot injuries is simple. All you have to do is get the bones into their proper alignment. In practice, treatment of midfoot injuries is quite difficult. Midfoot injuries occur in an area of complex and hidden bony anatomy. In Napoleon's time, Lisfranc injuries often led to compromised blood flow, which required amputation. Today, the treatment of midfoot injuries remains controversial. The tendons and muscles in the bone are strong, and they tend to hold the bones out of alignment. Therefore, once the bones are placed in their proper position, they must be held there with orthopedic hardware. K-wires or pins are sterilized, sharpened metal pins used to hold bone fragments together. The pins are driven into the bone through the skin. They provide temporary fixation. Before deciding what type of surgery would be performed, my orthopedic surgeon ordered a CT or CAT scan. CT, or computed tomography, is a medical imaging method used to generate a 3-dimensional image of the interior of an object from a large series of 2-dimensional X-ray images. If any of you ever get a CT scan, I encourage you to get them from your doctor. They're cool to look at, although utterly incomprehensible to me. But from the CT scan and from other imaging performed during the surgery, my surgeon decided to put K-wires in here as shown. If we take a look at the area outlined by a blue box blown up, we can see a little more clearly the fracture before a surgery, after a week of the pins being there, and then after 3 weeks. A line between the metatarsal and a fragment grows less distinct over time, indicating that the bone is healing. Post-operative treatment for Lisfranc injuries involves immobilization for as long as 3 months, followed by physical therapy. The prognosis, or prediction of outcome, for Lisfranc injuries involves a long rehabilitation of greater than 1 year and the potential incidence of traumatic arthritis, that is, arthritis caused by injury to a joint. but I'm getting better, and this injury won't stop me from going sailing this weekend and camping in Yosemite next week. My Lisfranc fracture dislocation has been a challenge to deal with, but it has also been a valuable learning experience, and no matter what, I won't let it stop me.